Welcome to the Integrated Rehab and Performance Podcast. My name is Dr. Nick Curtis, and I'm running the show here at the Integrated Rehab and Performance Center. Today, we are doing a podcast episode. I wanted to walk you through some of my golf rehab and performance treatment plans. I want to tell you a little bit more about me, the clinic, the idea and theories of the clinic, and what kind of separates us from your kind of typical corporate, maybe physical therapy or chiropractic offices. That, again, we're trying to separate ourselves from what you may have experienced before. It's a good reason for why a lot of my patients have experienced your typical physical therapy and chiropractic and are still in need of care. Again, that is kind of where we thrive, is on the patients or the clients that have tried other things and are still looking for the results. So that's what we're going to talk about today. I want to walk you through a couple of case studies. Again, build back in the theories of the clinic and what makes Integrated Rehab and Performance Center so unique. Okay, so to keep things simple, I am a golf rehab and performance specialist here in Nashville, Tennessee. Let me walk you through a case study with, this is one of my Brentwood Country Club patients. It is what might look like a typical kind of low back golfer case. This is someone who has been golfing kind of recreationally most of their life, and they get that typical low back pain. Now, I say typical because low back pain is very common in golfers, but again, there's nothing typical about it when you dive into the individual characteristics that are behind this discomfort, right, specifically for this patient. So again, this patient, low back pain, a little bit worse on the right side than the left. When we took a good look at it, where the pain is really coming from is kind of that L4, L5 region of the low back. And then we had some SI joint discomfort on both sides. So kind of this general vague ache in that low back that would happen during a round of golf, after a round of golf, and sometimes when trying to do other things like, say, get on the floor and play with grandchildren, right? So all these things, again, not uncommon, but when we take a closer look at some of the other things at play, we have what would be a very, very unique case specific to this individual in front of us. So what you might normally have seen if you've been to a maybe corporate physical therapy, and if you're not sure what that is, basically any physical therapy office you might walk into, they're designed for volume. See many people, maybe you were being treated with other people at once. Very protocol driven. When we have low back pain like this, if it doesn't have radiating symptoms and it's just low back general achiness, this is kind of the framework that you go through. If there is radiating symptoms, maybe you have plan B instead. Same thing when it comes to the shoulder joint, shoulder issues, neck pain, and knees, elbows, wrist, everything in between, very protocol driven. The issue here is with these sorts of offices, you come in with a complaint, you can almost guess exactly what exercises you're going to be given. You can almost guess the treatment almost exactly that you will be given, hands-on and exercise-based. So not very individual-based, complaint-based, but not individual-based. And I want to walk you through that process a little bit more. The same thing goes for chiropractic offices. You come in with a general low back pain case, you're going to get adjusted in that low back no matter what, right? And then maybe some of these other offices will throw in some soft tissue work and maybe a kind of generic exercise. It's about the extent of it. Integrated Rehab and Performance Center, again, we look at all the cause and effects throughout the body. Then we take a look at your golf swing. So here's another step that you just won't see anywhere else is I want to see that body swing connection. I want to see what are your swing issues, what are your swing faults, what are you telling me that you've noticed in your swing, and then what am I seeing in your swing? Now, my job isn't to fix to the detail, the very specific, precise issues of your swing. I leave that up to the swing instructors here in Nashville, but what I want to see is what are the big swing characteristics and how does that relate to the physical exam that we've done? Is there mobility issues that are coming up in that swing? Is there pain and positions you're trying to avoid because of the pain that are showing up in those swing characteristics? I want to correlate all those things and have a good sense of how these things connect. Okay, and then beyond that is I want to know if we take you from the ground up. Where are these mobility versus stability issues from the foot to the neck, right? Where's everything related in terms of, is there a mobility issue here or a stability motor control issue, right? That is how we build or start the process of building a very individualized treatment plan. So in this case, I had mentioned we had that very vague general low back pain. We know what activities would make it worse. But what I need to know is, beyond just doing general core strengthening exercises and some mobility stuff, is where do we need specifically this mobility? So we saw there was some hip mobility issues on both sides, and this is not uncommon, but we found internal rotation especially was missing on both sides. Why is this significant? When internal rotation at that hip is missing, if you think about yourself coiled up into that backswing, think about what's happening at the pelvis and the hip. That pelvis is rotating on top of that hip, that backside hip, right? That is internal rotation at that hip. The foot is planted, so the pelvis moves on a stable femur. That is pelvic on femoral internal rotation. Very important to be able to coil into that hip and be comfortable there. If we run out of that motion so quickly, what happens is that pelvis, again, it stops being able to move on the hip. So instead, to get into that backswing position, that full rotated position, it's that low back that'll start twisting and rotating. Now, we get a little bit of rotation through that low back, of course, but in this case, we're starting to add extra or excessive torque to that low back. Again, think about it. You're trying to coil your body into that backswing. What happens when that hip stops rotating, that pelvis stops rotating on that hip? To keep going, it'll go up one more step. That's that low back, that lumbar spine. And now we start getting excessive rotation in a region that is supposed to be more stable. It's supposed to be more of a flexion extension region that we're using excessively for rotation, torque. Okay, this is how, again, an issue, we don't have an issue at the hip, or at least we don't think we do. We don't have pain at the hip, but we have a hip problem that is causing low back pain in a way. This is something that gets missed in generic treatment plans. We have low back pain, we treat the low back pain, right? This is one of the many things that we need to understand better to have that individualized treatment plan for this patient. Beyond that, we had thoracic spine rotation restrictions. Not painful in the thoracic spine, but man, was there restrictions, especially in right rotation, which of course in this case aids in that backswing. So we have above and below restrictions. Hips below the low back and the thoracic spine above that low back. Both are restricted in rotation, just putting extra torque and demand on that low back. It makes sense that after a round of golf, that low back starts hurting because we are using it excessively to try to create what looks like a good backswing position. Now, the swing characteristics. We saw early extension. We saw loss of posture and flat shoulder plane. There wasn't too much sway or slide, but again, I think this had a lot to do with the fact that we're trying to avoid excessive pressure into that low back and pelvis. We don't have so much mobility in that pelvis that to add a slide or sway, this lateral weight shift, actually requires rotation at the hips, right? That would be putting more stress or requirements into that hip joint that we already didn't have. So I think he actually did a good job of staying relatively stable in that side-to-side plane, but that was mostly, I think, because, again, his body knew we were already restricted going in rotation, and we can't add anything else to this system in that regard. That being said, we had early extension, loss of posture, and flat shoulder plane. These are all characteristics in the swing that are not uncommon, will happen when we have missing hip mobility, or we're trying to avoid putting excessive tension into that low back. So we have this loss of rotation as putting excessive tension into that low back, and then we're trying to offload by standing up, right? So we take ourselves out of that hinged position that we want to stay in. We want to maintain that hinged position into the backswing and through the downswing. People that early extend, they stand up or they extend at those hips early. Again, in this case, why is that happening? I think it's happening because he's trying to offload that pressure in that low back. Now, this is a low back pain. This is a mobility at hip and thorax, amongst other joints that we had found, that is creating a swing characteristic that he's been fighting for a long time, which is that early extension. So now we have a swing issue that is caused by this low back pain, a change to the swing mechanics. So we found plenty of things to work on. These are just some of the highlights. we're going to incorporate all of these things into our treatment plan. This is how we create a very specific plan that goes from addressing pain, addressing function, and addressing performance, right? This is how we build all these things in together. We have to look at all these things, collect that data, analyze that data, make sense of it all, and then we can begin our treatment plan. If you've graduated care from a PT or a chiropractor where maybe that low back's starting to feel better, just because they've told you that you're good to go does not mean that we've made any true functional change. We can do plenty of things to make that low back start to feel better in the short term. But if we haven't worked to improve your connection with the ground, worked on foot, ankle, tibia, worked on that hip mobility, worked on that hip strength so it's strong in that new mobile positions we've built in, incorporated some drills that get you creating dynamic force, right? That means like explosive force into that hip, getting comfortable there, building that tolerance over time, building that mobility and strength over time, that we can then start to translate into swing-specific characteristics, right? So we can start building that explosive strength into the swing directly. Different drills for doing that. This is how we take you from step one to, again, the finish line. We need to do all these things together in a progression that to get that true translation. Even if that low back starts feeling better early on, we don't stop until those functional changes have been created so that it'll keep it that way, not to mention truly improve your capability on the golf course. So again, we use the hands-on approach. We address pain directly, but we also use hands-on and corrective/performance exercises to address the joints above and below throughout the body that are having and playing a role in this initial issue that brought you in. We take that another step further even, and we address it to the swing itself. We look at those characteristics. We do what are some things that can improve on these characteristics. And then finally, once all these things are looking better, we know you are definitely good to go. You're definitely good to go to the range and start practicing on some things. You're the most capable you've ever been to go to a swing instruction and get the most out of that swing instruction that you've ever been able to get. You are not in a position where a change that they're trying to make a swing coach in your swing is going to be fighting all of these physical restrictions that you have, and instead you are clear and able to make those changes, and the only thing that you have to work on is the fact that it feels so strange, these positions that you're being put into, and then also just working on that timing and ball contact. Now you get to focus on those, and you're not just creating compensations to get into these awkward new positions in the swing, right? We have enough to worry about there. We want to take those compensations away so that you don't have to do these things while creating compensations. You are just free to do them. No issues. You're not going to create problems elsewhere in the body. You're just, again, free to go to create these changes with your swing instructor. Another case study I kind of want to walk you through just briefly is someone that was sent to me from a swing coach here in Nashville. He's a Legends golfer, sent to me saying, hey, we were working through a lot of mobility issues here, specifically things in the thoracic spine. After a true deep evaluation, we found there was some thoracic spine restrictions, but the major restrictions, again, were coming from the hip and the foot. We had no mobility for rotation at the tibia on either foot. We especially didn't have any mobility for rotation at the hip, so similar to like our previous case. Now in this case, we had no pain, no discomfort, no issues. But on a performance side, again, sent to me from the swing coach, the instructor, saying, hey, we really need to work on thoracic spine mobility. What we found in the comprehensive exam is it was not just the thoracic spine. In fact, it was more so that lower extremity, but it revealed itself in what had appeared to be the thoracic spine, right? Now, of course, we had to work on all of these things, but again, without a comprehensive full exam, you never know what you're going to get. And this is a highlight of that mid to late stage treatment plan that we'll do even with someone in pain. We're just starting a little bit beyond that part of pain. Otherwise, it is exactly the same. What are all the joints that are at play? Where does we need to build in some strength? Where can we build in some mobility? And then how do we incorporate those things into a dynamic kind of explosive drills that are specific to what this patient client needs to work on? And then start translating that feel into the swing. And then from there, you're free to go. You are ready to take the most that you can from that swing instruction. As you can see, the instructor kind of valued how they were not able to get as much as they could from these sessions because of these mobility or physical restrictions. Not always just mobility. Sometimes it's strength, motor control, and often, almost always, it's both. And so that is how we build that value into the treatment plan, where we get to work on these things, whether you're in pain or not, right? All these things make a huge difference in that swing. First comes understanding fully your exam, comprehensive, every bone, ligament, joint, tendon, everything there is to know, and then understanding your swing and how those two things relate and how we prioritize making those changes. All right. With all that being said, I think that gives a good kind of description of what Integrated Rehab and Performance Center does, what is so unique about it compared to some of the other more typical clinicians, PT or chiro, and the reason behind that, the reason why we go to these extra steps and so in depth with everything, because that is where the true changes and improvements will happen. So thank you for listening. Again, this is Dr. Nick at Integrated Rehab and Performance Center with a golf podcast describing just a little bit about what Integrated Rehab and Performance Center is all about. So I hope you appreciated some of the examples here in this podcast. And otherwise, we look forward to seeing you in office. If you have any questions, don't hesitate to reach out. You can call or text the number, email, go onto the website, and you can find some ways of scheduling a free discovery call if you'd like, where we just go over what is that you have going on and how Integrated Rehab and Performance Center is able to help. So looking forward to it. Thanks. Bye.